everyone, this is Dr. Priyanka Mehta, obstetrician and gynecologist from Diva Women's Center, Chennai. Pregnancy is a beautiful journey, but sometimes for some women, the first 12 weeks, which is the first trimester, can be a very difficult period because of nausea and vomiting. So not all women will experience nausea and vomiting in the first 3 months, but sometimes it can be really bad. Now, what is nausea? Nausea is the feeling of throwing up when a woman will just keep feeling that gagging sensation and nothing will come out. And vomiting is when they actually throw up. So almost 70 to 80% of women actually face this problem of nausea where they feel they're going to throw up but they don't. And almost 50 to 60% of women actually keep throwing up, which is called vomiting. So why does it happen? Nausea and vomiting happens because of the hormonal changes, mainly because of a hormone called progesterone, which is the hormone which maintains pregnancy. And the reason why this hormone is going to cause this nausea and vomiting is this hormone will slow down all the processes. So the digestion is slowed down, the intestines are slowed down. So whatever is eaten is not digested fast. So what do we do about it? There are different methods and there are different things to do because of the nausea and vomiting. But I'm going to tell you 5 things that you should do and 5 tips that you should not do. So the things that you should do is, number 1, avoid taking, too heavy meals. So you have to make sure that you're taking at least 5 to 6 small meals but regular meals. So every 2 to 3 hours you keep eating little, and that is going to help you digest. And what you eat, you should have more of very simple carbohydrates which are going to be easy to digest. Number 2 is, we all know about lemon. So lemon is something which is not only good in vitamin C, but also it can help, all the different smells and all which we are thinking are going to cause nausea. So you can either have a lemon juice or just put a little bit of lemon onto your tongue, or just even smelling lemon also helps at times. Number 3 is ginger. So ginger, which is fresh, you can either make some, add it to your lemon juice, or you can just add more of ginger to your food so that this ginger also, or you could even just smell ginger. So ginger again is proven. Ginger tablets are also available. So that also can help reduce the feeling of nausea and vomiting. Ice cubes also, sometimes if women just take some ice cube and just, lick on the ice cubes also. This also helps that whole sensation of nausea to go away. And dry biscuits, not those creamy heavy biscuits, but just some dry biscuit which is going to, as you wake up in the morning, the first thing you can do is, even before you get out of bed, you can just munch on 1 or 2 biscuits. So these do kind of, make you feel better. What are the things that you should not do? So make sure that you are, like I told you, avoid having just 3 very, very heavy meals. So if you're going to eat very heavy meals, only 3, and you will going to get in between, your sugars are going to go down and then go up. So that also is going to increase the nausea. So avoid taking very heavy meals at one go. Second thing that you should avoid is, don't take too much of, juices or very sugary drinks at one go. So if you're going to take a lot of sugary drink at one go, the sugar is going to increase the movement, or peristalsis they say, of your bowels, and then everything is going to just come out. Also, you have to avoid spicy food. So spices could be just chili flakes. These days, many people are fond of these piri piri and different kind of, spices. So cut down on all kind of spices, because that is going to make your intestine, your tummy inside soothe. So if you're going to avoid spicy food, it is really going to help. Deep fried oily food also you need to avoid, because anything which is deep fried or using a lot of oil, again this is going to be rich in fat and it is going to be difficult to digest. Also, one more thing to avoid is, avoid all these salty snacks which you think are very interesting, all the chips and all which comes in packets. So if you're going to avoid all of that, it is really going to help you overcome this nausea. So not everybody will have nausea and vomiting, and if you're having nausea, vomiting, or if you're thinking that, the first beginning of pregnancy itself is so traumatic, because sometimes when this nausea and vomiting is either not corrected, or if it goes to, to be very severe, then it becomes something called hyperemesis, and hyperemesis gravidarum it is called HG. So sometimes it can become so severe that you may need to be admitted in the hospital, and you may need to take some IV fluids because you get dehydrated. So the key point is, and once you visit your doctor or your gynecologist, they will prescribe you tablets. These tablets are very safe in pregnancy. There is a tablet of B6 vitamin, that is pyridoxine, in combination with another tablet, doxylamine. So these tablets have been used by so many women. Millions of women have used it for so many years now. More than 40 years, 50 years, women have been using these tablets. And these are very safe tablets which you can either start taking one tablet at night before your meals, or you can even take 3 times a day. So don't suffer with this nausea and vomiting, because if you keep having nausea, vomiting, I'm sure you're not going to be able to enjoy your pregnancy at all. And this is going to cause, once you start throwing up, nausea, vomiting, it will just keep on increasing. So take care of yourself. Follow the dietary advice in terms of the food that you should eat and the food that you should avoid in the first few months of pregnancy. Take the medications which have been prescribed and which are very safe in pregnancy, and stay healthy and have a happy and beautiful pregnancy.